Hello and welcome to our special show, Let's Talk Infertility. I'm Priyanshi Sharma. In our previous show, we spoke extensively about the lack of awareness on what causes infertility and the stigma around open conversations about the silent struggle that couples or individuals face on their road to parenthood. That is the open conversation that we are bringing to you as part of this campaign, Let's Talk Infertility. Mr. Khatib, if I can come to you next, if we can now talk a little about genetic testing. How important is it and what role does it play in a successful IVF treatment? And what makes art fertility clinics different from the rest?
That's a very good question, especially that this topic is recently debatable. Now, one of the most common reasons for implantation failure or for miscarriages is chromosomal abnormalities, which is referred to as aneuploidies. Now, in order to investigate or to point out, find these embryos, we need to do a genetic test called PGTA. And if we want to search for a specific disease, we do a test called PGTM. Now, the field of reproductive medicine is a relatively new field of medicine. So imagine how new is the field of reproductive genetics. That's why in the past few years, we've seen a lot of improvement and advancement in the technologies available in order to do these tests. Now, the technology available today is very precise, can give a lot of information, and let's say relatively very accurate. The challenge is implementing a PGT program in any IVF clinic is not simple. Why? Because it's not only dependent on the technology used or on the genetic lab, but it's also dependent on the culture conditions, on the way we do the biopsy technique, and so on. The protocol we use or the technique we use in the lab, the culture conditions, in the past few years, we heavily investigated this topic. So we have more than 15 publications only in this topic, genetics, embryology, and genetics. Why? Because we understand how important it is. This is how we will be able to increase our success rate. This is how we will be able to, stand out as an organization or a fertility clinic. And besides doing the research in the IVF lab in order to design these protocols, implementing these protocols in our clinics in India, we understood that it's also very important that we ourselves perform the genetic testing in order to cope with all of these advancements, in order to understand more about the field of reproductive genetics. That's why we started our in-house genetic laboratory, equipped with the most advanced equipment, new technologies. And of course, we will be coping with all the technologies and tests that will be launched in the near future.